celebrating a great anesthesiologist statistician Dr. Emery N. Brown, MD, PhD. An interview between David Ferguson, AMRSC AMRSB, podcast producer and host, and Dr. Emery Brown, MD, PhD. Edward Hood Professor of Medical Engineering and Computational Neuroscience at Massachusetts Institute of Technology. He serves as a co-director of the Harvard and MIT Health Sciences and Technology Program, Associate Director of the Institute for Medical Engineering and Science at the MIT, and investigator for the Pekauer Center for Learning and Memory. So that's the sort of things I try to work on, like picking important questions. So is another illustration and thinking about circadian rhythms. The circadian rhythms are everywhere. So you can measure the aspects of the rhythm, say the period, the amplitude, and then from there, be able to make statements of uncertainty about, how confident we were about the characterizations that we came up with. And I just wanted to master that, and I thought that, well, I think what happened is I knew when I came to college, I wanted to go to medical school. That was for sure, and I can't remember exactly whether it was in my sophomore year or earlier, but I decided I wanted to do a PhD also. And that was how I just made the decision. This was a fairly avant-garde idea at the time, because when I entered the Harvard MD, PhD program, nobody had done a PhD in statistics before, and that was a rather new idea. But it was very clear to me that medicine was a field that had a lot of uncertainty, a lot of data, and even more now. And having people who are formally trained in how to quantify that uncertainty, make decisions on uncertainty, just seemed like a natural path.